My name is Linda Jackson. I'm a lifestyle medicine practitioner and member of the American College of Lifestyle Medicine. Thanks to advances in technology and medical research, we have learned so much about what is going on at the cellular level in diabetes. But sadly, this has had little impact on improving the health of those living with diabetes. When I was in nursing school 50 years ago, I learned that the two types of diabetes were juvenile onset or adult onset. Those terms had to be changed when teenagers and even some young children were diagnosed with the adult onset type. The terms used now are type 1 and type 2, with type 2 diabetes being far more common, and that's what this presentation is addressing. According to the CDC, about 1 in 10 Americans has diabetes, and as many as 95% of them have the type 2 kind. Now I have to be honest and give you the bad news first. If diabetes is not controlled properly, it may lead to blindness, kidney disease, or heart disease, and it's the 7th leading cause of death in the United States. But here's the good news. When you understand the root cause of diabetes, you'll know how to control it and possibly put it into remission. The best way I know to explain the disease process of diabetes is to demonstrate it. When you eat food, your body digests it and turns some of it into sugar molecules which go into blood vessels. These white balls represent the sugar molecules inside a blood vessel. Your body needs to turn these sugar molecules into energy, but that doesn't happen here in the blood vessel. It happens inside muscle cells, which these glass jars represent. The problem is that sugar molecules cannot get out of the blood and into muscle cells without help, and that's insulin's job. Insulin is made by the pancreas. It's roughly this size and shape. It's located behind the stomach in the left midsection of the body. The more sugar molecules are in the blood, the more insulin the pancreas releases into the blood. This toy bulldozer represents an insulin molecule. It enters the blood, picks up a sugar molecule, takes it out of the blood, and brings it over here to a muscle cell. Notice that it has a key in the front. When the key works, the sugar molecule goes right inside. Sometimes, when the insulin picks up a sugar molecule, takes it out, brings it to a muscle cell, that key isn't working. It's trying, and the door isn't opening. It's as if the lock is jammed. When that happens, some sugar is able to get inside, but the rest goes right back into the blood. Doctors call this insulin resistance. When the resistance is strong, blood sugar levels go higher and higher. Notice that the two jars are not the same. The resistant one has cotton balls inside, which represent fat. High-tech imaging techniques clearly show this fat, called intramyocellular lipid. Intra for inside, myo muscle, cellular cell, and lipid is just fat found in the blood. A healthy person's muscle cells do not contain any fat. So where does this fat come from? It comes from food in two different ways. Obviously, one way is by eating too many foods high in fat. Surprisingly, the other way is by eating too many highly processed foods, including drinks. They come packaged in bags, in wrappers, aluminum cans. These food-like substances are made in factories and often have a long list of ingredients. It's common for various kinds of sugar, including high fructose corn syrup, to be included. During digestion, these sugars can get turned into blood fats. And the body needs some fat to be healthy, but extra fat gets stored in fat cells, which is represented right here. When the fat cells are full of fat, as this one is, and more fat comes into the blood, it needs a place to go. Some of it goes to muscle cells, where it doesn't belong, and it doesn't need any help to get inside. Medications like metformin make it easier for sugar molecules to get inside muscle cells, even when there's a bit of resistance. But when there's a lot of fat in muscle cells, pills may not be enough to lower blood sugar to a healthy range. Then a person may need insulin injections. And it can be challenging for the doctor to figure out exactly the right amount of insulin to prescribe to work alongside the insulin that the body is already making. If there was a way to get fat out of muscle cells, then insulin resistance would no longer be a problem, and blood sugar molecules could easily get out of the blood and into muscle cells. The good news is that there's more than one way. When a person starts eating food with less fat and avoids highly processed foods, the body starts using some of the fat that's been stored in the fat cells. So the fat starts coming out, it's leaving more room. Then the fat that has been stored where it doesn't belong here in the muscle cell can come out and go in a fat cell where it does belong. Then the insulin key works in the way it's supposed to, and sugar molecules can go right inside muscle cells where they are needed to make energy. There's a different way to lower the muscle cell's resistance to insulin, and that is by moving more. This can be done by simply walking for 10 minutes after a meal. If that's not possible, any increase in physical activity throughout the day will decrease insulin resistance and lower blood sugar. A goal to work toward is 30 minutes of moderate activity on most days. If it's difficult to find a 30-minute window to do this, then being active for just 10 minutes 3 times a day gives the same benefit. If you have a blood sugar monitor and are taking medication for diabetes, check your blood sugar each day before breakfast and keep your doctor informed about lifestyle changes you make, as well as changes in your blood sugar numbers. So to wrap this up, a common sense approach to controlling blood sugar is, number 1, eat more food low in fat, vegetables, fruit, whole grains, and beans. Eat fewer high-fat foods, such as cheese, eggs, fried foods, meat, and poultry. Number 3, avoid highly processed foods. Number 4, make water your beverage of choice most of the time. Number 5, be more physically active. So I've explained in simple terms what causes diabetes and the steps that can be taken to treat the root cause. You have the knowledge you need to control blood sugar, but there's often a gap between knowing and doing, and that's because change is hard. Unless there's motivation and support, it's a very difficult road. So I encourage you, talk with your loved ones. Tell them what you want to do and why you want to do it. Then request their support. As you lose weight and your blood sugar starts coming down, the medication doses you used to need will be too much. So it's very important to keep your doctor informed during this process. I believe you have what it takes to join thousands of others who in recent years have put their diabetes into remission. So my challenge to you is go for it.